Hello, welcome to this pharmacology update for the PACER series. My name is Mike Tevald. I'm an associate professor of physical therapy at Arcadia University. I'm also the treasurer of the cardiovascular and pulmonary section. Joining me in this lesson is John Lowman. He's an associate professor of physical therapy at the University of Alabama at Birmingham. Disclaimer, this course is intended for educational purposes. It obviously does not replace mentorship or consultation with more experienced cardiopulmonary or acute care colleagues. Additionally, the information contained in this slideshow is current as of the time of dissemination, but COVID is a rapidly changing event and information is subject to change. The authors have no conflicts of interest to disclose. Our objectives for this lesson are to describe the major classes of medications used to manage common diseases of the cardiovascular, pulmonary, and metabolic systems. And by the metabolic system, we're going to primarily focus on diabetes. We're going to discuss the physical therapy implications of the use of these common medications used to manage these different conditions. And we're going to discuss briefly some emerging trends in the medical management of COVID-19. We're going to start this lesson off and close this lesson out with a patient case. So Mrs. J is our patient. She's a 64-year-old woman. She was admitted to the hospital with fever and shortness of breath. She did test positive for COVID-19. Her pulmonary status worsened and she needed to be intubated and mechanically ventilated for 10 days. So she developed acute respiratory distress syndrome and needed mechanical ventilation. She, however, did survive, was ultimately extubated, and was discharged from the hospital 16 days later. Her past medical history, which we're learning that many of the people who develop the severe form of COVID have comorbidities. Her past medical history includes coronary artery disease, and she did have a myocardial infarction 3 years ago, COPD, hypertension, and diabetes. Her current medications include metoprolol, lisinopril, clopidogrel, atorvastatin, metformin, Spiriva, and albuterol. And one of the things that we want to kind of close out with is how might Mrs. J's medication impact her rehab, and what should her PT know about the medications used during her hospitalization. So we broke this course up into a series of short segments. So we're going to have 2 lessons on cardiovascular medications. Then we'll have a lesson on the medical management of diabetes, a lesson on respiratory medications, and again a brief summary of the medical management of COVID-19. And finally, we'll come back to the case and close out the lesson.